I have regularly for the past. Well, in fact, it was on the agenda for our the conference that we never had back in the middle of March, when the First Minister's Conference was canceled, the face-to-face conference, and we went to these regular telephone operations. I have to give credit to Brian Pallister, the Premier of Manitoba, who has been relentless on this issue, as has Adrian Dix, I have to say. So I get it in my own cabinet, and then I get it when I'm on the calls with the other premiers. And Pallister and I have been kind of a tag team on this question at every meeting we've had since probably into going back to 2018, prior to the last, 2019 certainly, prior to the last federal election, making the case that although it would be delightful to have more social programs initiated by the federal government, let's focus on that primary fundamental social program that separates us from the United States, and that's universal, accessible, quality public health care. And we are underfunding it at the federal level, have been for some time. This is not a criticism of the current government. It goes back a number of years. It's time to fix that, and I've been making that case at every meeting, and I'll continue to do that until we see some change. I have to say, I talked to the Prime Minister privately this week. We didn't discuss that. We had a range of other issues, but he knows full well my view on this, as does the Minister of Finance. Carol James raises it at the federal table as well. And I believe that the government understands that although they have a lot on their plate, and I give full credit to Chrystia Freeland, the Prime Minister, and their entire team for trying to find places to fill gaps as we struggle through this as a nation, and the disparities across the country are well known. Not even before COVID-19, but certainly during COVID-19, we've seen differences in how people are reacting, how provinces are responding, and the federal government has to manage all of that from a federal perspective. But we are separate and unique orders of government, and the federal funding formula is not serving healthcare services the way it did in the past, and it has to change in the future.